Diet, exercise, lose weight, metformin, insulin, Wegovy, amputation, blindness, kidney disease. These are the words that people hear or read about when they are presented with the diagnosis of diabetes or prediabetes. They're scary. What if I told you that there was an incredibly important variable that relates to diabetes and prediabetes that is almost never talked about? Our gut health is probably the most underappreciated variable in blood sugar regulation. And surprisingly, like I said, no one's talking about it. And here's the kicker. You don't necessarily need to have GI symptoms for this to be a problem. In this video, we're going to share with you 3 ways your gut health will impact your blood sugar regulation. We're going to share our 3 favorite functional medicine tests for gut health and our 3 favorite gut health products that have been critical in restoring gut health and influencing blood sugar regulation. And stick around to the end of the video to get a download for even more resources that address blood sugar regulation and your overall health. I'm Dr. Derek. I'm speaking to you from Revive Naturopathic Medicine, and we are a team of naturopathic doctors whose mission it is to educate and empower others with the contextual, practical, and nuanced information that's sorely missed in many, many health discussions. Evaluating and optimizing gut health has been a cornerstone of our practice, as almost all disease has some connection to our gut health and the health of our microbiome. And while this is a relatively new field of medicine that evolves at a fast pace, we know that it's a critical pillar to address and support. The impact of our gut health on blood sugar regulation and diabetes has recently been highlighted by the wave of people using Ozempic and Mounjaro and Wegovy, semaglutide, and other similar medications to manage diabetes and lose weight. So what's the connection there? To answer this, we need to start with a little biology lesson, but stick around. It's a fun ride, so hold on tight. All of those medications that we listed are in a class of drugs called GLP-1 agonists. Okay? GLP stands for glucagon-like peptide. And an agonist is a molecule that sits on a receptor and stimulates its function, versus, say, an antagonist, which would slow that function down. And guess what? Glucagon-like peptide is a normal peptide made by our body. Where is it made? It's made by cells in our intestinal lining. So to break this down, these drugs are basically synthetic molecules that mimic a natural peptide naturally made by our intestinal lining. And it makes you wonder, if we had better gut health in this country and world, would we have such a problem with diabetes and obesity? And while we're not suggesting everyone go run and start these drugs, it does highlight how a healthy gut and microbiome can influence blood sugar regulation and influence weight loss, because these drugs have been relatively successful in this arena. So where are the places we see gut health go wrong? And then how does that impact blood sugar regulation? We'll start with improper digestion. We know that blood sugar fluctuates heavily depending on the macronutrient makeup of our meal, the balance between carbohydrates, fats, and protein. Carb-heavy meals tend to spike our blood sugar, and meals that are heavier in protein and fat tend not to spike our blood sugar nearly as much. But what if you're eating meals with a decent amount of fat and protein, but your digestive juices are insufficient to properly break these nutrients down? Since carbohydrates are relatively easy to digest, but proteins and fats take slightly more complex digestion, a system that can't break down protein and fat well will be left predominantly with access to those carbohydrates, thus spiking blood sugar. So you might ask, why might one have compromised digestion? And I would say the most common reason we see this in practice is due to stress. And in fact, we have a video specifically about how stress impacts blood sugar regulation in the description below. So you can click that link to check it out. I would say out of all the digestive insufficiency cases that we see in our clinic, there is predominantly an underlying problem with stress and the stress regulation systems in the body. The second factor is inflammation. An inflamed GI tract is not a happy environment. Not only can it cause symptoms of pain, bloating, diarrhea, constipation, but when our intestinal lining is inflamed, it becomes damaged. And of course, this damage has immunological, metabolic, and even behavioral consequences. Intestinal cells, also called enterocytes, that are inflamed are not able to produce chemical messaging signals as effectively. And these GI chemical signals directly affect how our immune system is regulated, how our metabolism and things like insulin are secreted, and even behaviors like appetite. A good example would be an inflamed gut can't make GLP sufficiently, which can lead to poor metabolic health, elevated glucose and insulin levels, difficulty losing weight, systemic inflammation, and certainly in bigger appetite than we would desire. A third factor we have to take into consideration as it pertains to blood sugar regulation is dysbiosis. And we use this word in functional medicine to describe dysfunctional microbiome, okay? And it's a pretty broad term. It can mean a lot of different things depending on the context. But at its core, it speaks to certain microbes being present or certain microbes not being present in a variety and abundance that we want. Okay? And it's been shown that alterations in our microbiome can influence things like inflammation. It can influence insulin sensitivity and even how we utilize energy, meaning how we burn glucose and how we burn fat. And all these are key factors in diabetes and prediabetes. Remember though, like all gut bugs aren't bad, and most are in fact are great and do amazing things for us. But when we feed our microbiome correctly, usually through the influence of dietary fiber, these bacteria make valuable compounds for us. And there's one in particular that I'd like to highlight, and that is what's called a short-chain fatty acid called butyrate. Butyrate is a byproduct of fermentation, meaning when we eat fibrous foods, the microbes in our gut, mainly our colon, take this fiber, they use it as energy, and as a byproduct make butyrate, a short-chain fatty acid. And there are other short-chain fatty acids, but butyrate is one of the more exciting ones we know. It has a role in immune regulation. It's a protective against colon cancer. It helps regulate our appetite, and you guessed it, it plays a pivotal role in regulating blood sugar. Butyrate has not only direct effects on blood sugar regulation, but it is also the compound that stimulates our intestinal cells to create GLP-1. You see how this all connects? So we're big fans of butyrate, and in fact, we test it in many of our patients, especially with diabetes and prediabetes, as well as patients who suffer from autoimmune diseases. This will move us perfectly into our top 3 functional medicine gut tests. That said, before we discuss these, I want to make it clear that these tests are not replacements for testing like endoscopies or colonoscopies. Those are both valuable tests that provide critical information for many cases. That said, these functional medicine tests do look at things that those tests simply don't. So let's jump in. The number one test I would put on our list that we use in our clinic is by a company called Doctor's Data, and it is their comprehensive stool analysis and parasitology. So this is a stellar test for assessing the inflammatory load in the gut, the digestive capacity, short-chain fatty acid production, including butyrate, and it's a good assessment of potential dysbiosis. It has a combination of data from stool cultures, microscopic examination of the stool, as well as DNA testing. We found it reliable, accurate, and it's reasonably priced. Number 2 is a breath test for small intestinal bacterial overgrowth. The most common versions of these that we use are the lactulose breath test by a company called Commonwealth Diagnostics and a test called the Trio Smart by Gemelli Biotech. So this test is a specific test for diagnosing small intestinal bacterial overgrowth, or also known as SIBO. This is a condition that can cause gas, bloating, abdominal pain, heartburn, constipation, diarrhea, weight gain, and a host of other symptoms. It's a very useful test when this constellation of symptoms is on board, because small intestinal bacterial overgrowth tends to be a very multifactorial problem. The third test is called the Biome FX by Microbiome Labs, and this is a relatively new technology that evaluates the DNA of bacteria present in your gut. So while the previous test from Doctor's Data can look for the absolute amounts of butyrate in the stool, this test can tell us how much butyrate producing bacteria we have living in our microbiome. So you can kind of see the difference there. And of course, it's not just testing for butyrate. It gives us information on all sorts of families of bacteria that relate to our immune system and inflammation, allergies, hormones, and other dysbiotic factors. Knowledge is power, but without action, it's simply information. So how to create action? It goes without saying that all of our treatment plans at our clinic are highly individualized, but of course, there are common interventions that often show up. And so I want to share with you the top 3 players in many of our gut and blood sugar regulation plans. The first player is Glucose Control Pro by Pendulum. This is a specific probiotic that has some relatively newer probiotic strains, and they've been shown to increase butyrate production and help lower post-meal glucose spikes. So you can see already how that would be a valuable tool. Clinically, however, we've seen this probiotic aid in reducing food cravings and snacking. We've seen it improve gut symptoms like bloating and loose stool. And in fact, some cases it's impacted conditions like eczema and other skin conditions. We use it commonly in plans that have a weight loss angle, and it's been a successful tool. The next compound is called tributyrate, and tributyrate is a compound formulated by many companies. It is a prodrug or a precursor molecule to butyrate, but it's much more bioavailable and has less of the kind of smelly stink that sodium butyrate counterparts would have. So we've talked about the importance of butyrate and how it has its hands in so many different pots. It's a wonderful tool to help bump up low butyrate levels while working on the bigger microbiome challenges in the body. As we discussed before, butyrate can impact production of GLP-1 and thus can have an impact on how well that body can regulate blood sugar and insulin levels. And so it's commonly a part of our plans for our diabetic patients or pre-diabetic patients. Last, but certainly not least, is a compound called berberine. Berberine is derived from many herbs, I would say most notably barberry, golden seal, and Oregon grape. But it's one of the most multi-purpose herbal compounds we have in our toolbox. It has impacts on insulin sensitivity and blood sugar regulation, but it can also help impact cholesterol levels and LDL levels, as well as it has antimicrobial effects in the gut, as well as it is a prebiotic for a certain gut bacteria called Akkermansia, which, of course, is a well-known butyrate-producing bug. So I love when herbs or supplements have multiple beneficial effects, and it helps us kind of create very well-rounded treatment plans without having to add supplement after supplement after supplement. And berberine is one of those really valuable tools. As you can see, blood sugar regulation is incredibly important and multifactorial. We commonly use CGMs or continuous glucose monitors on many of our patients to help understand the nuances of blood sugar regulation. If you want an in-depth look into optimizing your blood sugar regulation to match your goals, we've meticulously designed a 30-day CGM program where you can work directly with one of our qualified doctors who understands the nuances of blood sugar regulation, how it relates to gut health, and how it relates to your overall health and well-being. You can click on the link below in the description to schedule a free 15-minute call with us to discuss the details of the program and if it's right for you. And if you haven't heard of a continuous glucose monitor before, then maybe start with our video, Why Everyone Should Wear a CGM. It's a good starting point to understand why we think everybody should have an experience using a continuous glucose monitor. We also understand you may be interested in arming yourself with more information on your gut health, or live in an area where access to testing or functional medicine and naturopathic doctors is limited. There is a link below where you can order your own functional lab testing. This can help you and your healthcare team develop more comprehensive, nuanced plans for your health and really kickstart and launch some additional learning for you. For more information on the supplements we listed, you can check out the links in the description below for access, as well as links to research supporting their utilization in practice. Lastly, I want to leave you with one more pearl about blood sugar regulation. Have you ever heard of someone stressing themselves into a heart attack? Well, have you heard of anyone stressing themselves into diabetes? Stress and stress hormone can wreak havoc on our blood sugar regulation. And we made a video addressing just this. And it's a huge variable in many cases, especially ones that are stubborn and resistant to cases, people that are trying to do all the right things, yet they're still having a challenge. So you can look for the link of that video below. And from Revive Naturopathic Medicine, thanks for watching.